We talked a little bit about removing the wrap 48 hours after your surgery. I want to be a little more specific about that 48 hours. 48 hours is counted from when your surgery is finished. So if you leave our office at 3 o'clock in the afternoon, that 48 hours is from 3 o'clock in the afternoon of that day of your procedure. Once that 48 hours is complete, you can take that wrap off, and you can have someone to help you do that and remove the wrap, and then you might have a little gauze or some foam underneath there, and then you're going to get in the shower and you're going to shampoo your hair. It's okay to use regular shampoo, and make sure you clean all the areas. If there's some incisions up here or around your ears, to clean it all up. Shampoo your hair and gently dry it with a cool hair dryer. And then you're going to clean the incisions like we talked about with the hydrogen peroxide in the water and put a thin layer of bacitracin. Those first few days while we're working on getting the scabs loose, your hair might be a little bit greasy. It's okay to shampoo and wash your hair every day if you need to. Please don't pick any of the scabs. And if you touch things around the house, if you're touching doorknobs or if you're touching anything, a dog or a cat, please wash your hands before you go and clean your incisions again, because you can spread that bacteria from the animals and from different parts of the house into the areas of where the incisions are, and that can lead to an infection. So it's very important that you clean all those areas. Another tip too, if you do have animals and they sleep in your bed, please clean or put a clean pillowcase or a sheet down on your pillow every day, so you have a clean area while your incisions are healing. Your TED hose are something that we recommend that you have during your procedure. You can wear these up to 14 days. However, we do recommend that you start walking the first day after your procedure. If you're walking normally and not laying around a lot, you can take your TED hose off, but if you tend to lay around, we want you to wear these for up to 14 days. Your TED hose help with the circulation in your lower legs. And just another tip for you to remember, if you happen to fly on an airplane or sitting in the car for a long period of time, throw those TED hose on so they get multi-use out of them. The last point I'd like to make is something for you to watch out in those 48 hours before you come back to see the doctor. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.